Hey guys, how we doing? Dr. Lee here. Today we're going to talk to you guys about building a healthy immune system from the inside out. Now, obviously, unless you've been living under a rock for the last 4 years, the whole topic of immunity and viruses has been ever present in our culture. Obviously, dealing with the worldwide phenomenon of COVID, we've seen a lot of news and people talking about the importance of having a healthy immune system. And although I've seen people talking about it, unfortunately, what's kind of happened in the world, especially in America in the last 4 years, has been absolutely atrocious when it comes to a whole health standpoint. We've seen cases of diabetes massively increase, obesity increase, heart disease risk. Studies have been published that your risk of heart disease has gone up since 2019. That's for all Americans. We're seeing cancer cases increase. There was a large 50-year study showing that 14 different types of cancer have been increasing, and most of them increasing not only in how often people are getting them, but that they're being gotten at younger and younger ages. And so what I want to spend some time with you guys going through today are really just the 7 components of building a healthy immune system for your understanding to better your knowledge on this. Knowledge is nothing without action. So the goal of this is that you can take what we're going to talk about today, turn this into action steps so that you can be healthy, not only now, but for years to come. We recently had a patient come into our office who recently overcame cancer, and he's been fighting this fight for about 5 years. He sat through a recent workshop that we did on this and said afterwards, he goes, listen, I learned more about how to build my immune system, about how strong my body is, literally in 3 hours of doing the seminar that we just finished. He said, I learned more during that time than I learned in 5 years undergoing cancer treatment. There are so many research-based studies on the things that we can do, the action steps we can take in our lives to build a healthy immune system. So not do we not get sick, but that we recover from fighting off illnesses very quickly, and we're sick very, very infrequently. And so what we're going to walk through are really the 7 big components of that. So that's nutrition, exercise, toxicity, having a good education and mindset, knowing the right action steps to take at home, how to fast properly, all of those things to increase your body's overall immunity and reduce your risk of getting a lot of these chronic diseases that we're seeing that absolutely be rampant in our community. All right, so I think the first thing that we should do is start kind of dispelling some myths that have really propagated maybe the last 3 to 4 years. And what I'm talking about is kind of step 1 here, which is understanding the difference between the germ theory and the terrain theory. We've kind of been led to believe for the last 3-4 years that germs, viruses, bacteria are the things that make us sick. And the reality, and if you looked around, you saw this, was that some people got tremendously more sick than others. In fact, you'd have people in the same room, one person got really sick and one person had no symptoms at all. And so the idea is that there's 2 conflicting theories here, and I think that they really both have some value. We need to understand this. There was something that Louis Pasteur came up with in the late 1800s called the germ theory, and that said basically, hey, germs are the major cause of disease. Germs are what cause our body to be sick, and they're what cause us to suffer with illness. And there was another doctor at the time, Antoine Beauchamp, who came up with something called the terrain theory. And I love this theory because this really helps fill in a lot of the holes that are in the germ theory. In fact, Louis Pasteur often admitted that germs weren't everything, but didn't come up with another theory to describe that. And so what the terrain theory says is what all these wellness doctors and all this new research is showing to be true is that it's not the germ that is the issue. It's your terrain, your body, that will tell us whether a germ is going to take hold and make you sick or ill, or whether it's not going to affect you at all. And so the terrain theory takes into account 3 really important factors. That's how healthy your body is, what kind of a dose of the germ are you actually getting inside of your body, and what's your body's capability of actually fighting that off. And so I think that, for my family, for my kids, I don't want to teach us to fear germs. I want to teach my kids and my family and everyone in my community how to work on actually building your health, build a strong, healthy terrain so that you can fight anything off as it comes at you. Listen, germs aren't going away. Viruses aren't going away. Every year or 2, we see this, avian bird flu, swine flu, H1N1. We've always seen these viruses or these opportunistic pathogens coming into play in our environment. And so really the important thing is to understand how to equip your body so that you don't suffer from those. The next thing that we're going to talk about is number 2, expressing health versus being sick. And I think those are 2 big things that you want to differentiate. Listen, humans were not made to never get sick, okay? Let's take chickenpox, for example. If we've never been exposed to the chickenpox virus before, and we get exposed to it, that's a brand new pathogen that our body has never gotten to see before, right? So our body has an innate immune system, and that innate immune system is going to work on fighting that thing off. So the first time that we're exposed to a new pathogen, whatever it is, if our body has never seen that before, it's going to take some work to fight it off. And that's the immune system that we all have come to know, and really honestly, I don't think we like it. It's the one that gives us the sniffles, the snotties, the high fever, the temperature, the malaise, the fatigue, the need to sleep, 12, 14, 16 hours a day. That's our body's innate immune system. And I want to tell you this, that's not a bad immune system. What I like to do is call that immune system not getting sick, but expressing health. The reality is that your body is doing that to create an immune response and kill off that bad thing. And so oftentimes we look at those as bad things, having sniffles, having runny nose, having a fever as being a bad thing, when really that's our body expressing health. Now, there's really honestly kind of a limit on maybe how often you should be expressing health. If there's someone who's expressing health, fighting off stuff, once a week, well, then we definitely would look at that and say, wow, there's some type of immune compromisation there. But I've read books, in fact, that were titled Never Get Sick Again, and that's not the case in the world that we live in. Viruses, bacteria are constantly mutating, and our immune system doesn't have a record of all of those things, so it literally needs to fight them off, learn how to beat them, so that the next time when we're exposed to a pathogen, so let's say we got chickenpox when we were 4, 5, or 6 years old, the next time that we're exposed to chickenpox, we don't get it. While our body is snotty and sinusy and having a fever and fatigued and malaised, and by the way, the reason you're fatigued, it costs 12 to 1600 calories a day to run your cell-mediated immune system. So of course your body's going to be tired. While you're fighting that off, your body is making Xerox copies, wanted posters, so to speak, of that bacteria or that virus, so that the next time that you come into contact with it, you can fight it off immediately. In fact, the next time you come into contact with that virus, you don't get the sniffles or the sinuses or the fever or any of those symptoms or problems or warning signs. Your body just kills it off because it knows exactly how to do that. And so kind of just for a rephrasing purpose, having young kids, when they're sick, I don't tell them, hey, you're sick. What I tell them is, listen, your body's expressing health. Your body's doing the right thing at the right time so that you can build your own immune system. And if you look at the problems that we've had in the last 3 to 4 years, our immune systems have been under fire. Lack of exposure, overuse of antibiotics and antibacterials, overuse of disinfectants, because we feared a germ and we didn't work on building our body's own immune system. So now coming out of this, what we're seeing more often in our clinic is patients are expressing health a lot more often. We're literally rebuilding our body's immune systems because we've been in isolation for such a long time and we've had such a small exposure to different germs or different pathogens. So it's really about understanding the difference between those two. Expressing health every once in a while is not a bad thing. Your body has to accommodate to new viruses and bacteria, but we want to do all the other steps in here to fortify our body so that we recover faster and so that we really don't end up developing long-term disease, which is heart disease, cancer, diabetes, all of those things that result from damaging our body for years, if not decades. All right, so the first thing we're going to talk about when it comes to building up your body's own immune system is really the importance for gut health. Our gut is where most scientists agree 60 to 70% of our immune system comes from. In fact, we have 3 to 5 pounds of bacteria sitting in our gut, and that's really where our body's immune system is. Our gut has been under massive amounts of distress for decades, and there's a lot of things that cause this. Stress raises cortisol, it affects our body's hormones. We have nutrient deficiency in foods, so our foods are not getting as many nutrients as they were before. There are countless studies now that show that the same vegetable, had you eaten it 30 years ago, would have given you more vitamin C, more micronutrients, more enzymes. And so we're not getting as many nutrients as we were before. On top of just not getting enough nutrients from good foods, most of us are eating foods we shouldn't be eating in the first place. Things like processed and ultra highly processed foods. Those are foods that contain damaged oils, lab processed fats, fillers, additives, chemicals, all the things that our body really doesn't need and has no purpose for, but have been shown to make us sick. Unfortunately, food marketing companies have a lot of things on their mind. Usually getting you healthier is not one of them. It's taste, it's profit margin, it's shelf life and sustainability for their business, and a lot of those don't correlate with long-term health and definitely correlate with a damaged gut microbiome. So on top of all of those things, if you look at those, the last 3-4 years, we've really weakened our immune systems, which is why you saw people who were more unhealthy have a tougher time fighting off this virus And really, they were just sicker overall, so they had a tough time fighting off everything inside of their body. So one of the really important steps here that we want to talk about is how to work on getting your gut healthier. The process that a lot of us go through is that when we're born, we should really be focused for the first year or two on sealing and healing our body's gut. Unfortunately, that's not happening. There's a lot of issues that cause this. The first being the high rate of cesarean sections in the US. Babies are literally, it may sound weird, babies are meant to be born vaginally. A vaginal birth is what gives babies their first bath in bacterium, and a lot of babies now aren't getting that. On top of that, the high amount of disinfectant use and the lack of nutrients from the mother doesn't oftentimes get transferred to the baby. On top of that, a lot of women now are having trouble breastfeeding, so that means that babies are being fed formulas, oftentimes with damaged fats. And then what I'm commonly seeing is babies switching to more processed foods, wheats and grains, before their body's gut has a chance to seal and heal. And so we're driving this inflammation and this leaky gut syndrome that's causing a lot of problems with our body overall. Okay, so basically what happens is our body has these tiny bonds that form in the lining of our gut, and those seal and heal the gut. Well, when we're born, we have a leaky gut. So over time, between year 0 to year 2, that gut should seal. If we're not getting the right nutrients from birth, if we're underdeveloped, if we're not getting the right foods, if we're eating bad, damaged foods, or have high amounts of stress, it can cause this gut to become leaky. And the same thing can happen if you're 6 or 10 or 20 or 30 or 40 or 50, whenever it is. If we're doing damaging things to our body, over time, we're going to start to damage our gut biome. We're going to select for bad bacteria by eating too much sugar, or we're going to kill off the good bacteria by not giving them the nutrients and foods that they need. And so the end result of this is that we start forming inflammation inside of our body, and we've all heard of that before. Inflammation is the thing that leads to weight gain, to hormone imbalances, to arthritis, to depression. Inflammation in our gut is what really leads to this cascade of lowered immunity. So what happens is we get inflammation, we break down the lining of our gut. These are what lead to problems like food intolerances. Well, if people come into our office and say, "Doc, I'm just really sensitive to that," or they'll even try healthy foods and say, "Doc, I really don't like that healthy food. It doesn't taste good for me," or my body can't handle it. Food or intolerances are a warning sign that your body's immune system is starting to attack itself. Certain foods are actually leaking outside of your gut, and those are what are causing you to be sick. Immune system issues and autoimmunity are what follow. And what autoimmunity is, it literally means that your body is attacking itself. Autoimmunity is something we don't want. That's allergies, asthma, eczema, certain types of arthritis as well. Those are autoimmune conditions where your body's literally attacking against itself. And this happens because, again, we have a weakened gut. Undigested food is not making it into our body. It's literally coming out of our periphery, and that's what's causing us to be sick. So one of the most important things to do is work on correcting and fixing these gut issues as much as possible. So that's first and foremost educating yourself on what causes the gut to be healthy or unhealthy. So step 1 is getting the toxins out of your body. That's making sure that you understand good foods, bad foods, what chemical additives are. So my rule of thumb is if I'm going to a grocery store and I'm reading labels, because you have to read labels when you go to the grocery store, if you see big words on those labels that are foods that you can't pronounce, that are preservatives, that are bad or unhealthy oils, which will say hydrogenated or partially hydrogenated, canola oil, safflower oil, things like that, here's what you do. You take that item and you put it back on the shelf. So you want to start looking for healthier items overall. And if you guys have questions on those, I'll put a link to some places where you can find those healthier things below. But you've got to understand how to get the toxins out of your diet. You also have to work on getting the toxins out of your home. So it's using better, healthier cleaning products, switching over those, getting healthier laundry detergents, not using fabric softeners that coat your pores that don't allow you to sweat properly, making sure you're getting the right nutrients to let your liver and kidneys detoxify your body like they normally should. The other thing is stress. A ton of us have massive amounts of stress that we can't get rid of. So we're stressed about our kids or our family or presentation, and usually stress is good for our body. Stress in the short term helps our body recover from something that it wouldn't have otherwise done. So for example, if a lion walks into the room right now, I should definitely be stressed. The reason I'm stressed is so that my body can have a fight or flight response, put blood into my muscles so I can fight the lion or run. That's a good type of stress. A bad type of stress is chronic stress, where you have anxiety, you're worried about things that you can't change. The way that I say this is that your circle of concern is greater than your circle of influence. You're worried about things that you can't change or you can't make difference of. A lot of times we get stuck on this with world issues, and our body starts to stick itself in this fight or flight response where you're constantly running in this stress pattern, where your body can't accommodate to that. Eventually, people who live under stress for a long time develop more disease. Stress raises your blood pressure, it downregulates your immune system function, it puts all the blood in your muscles of your body as opposed to being in your organs where they can run your immune system. So people get tense, they get taut, they get back issues, they get neck problems, they get headaches, they get migraines. And that stress over a long period of time does not allow your body to be in a healing state, which is known as a parasympathetic state for your nervous system. So over time, we really start to develop a stress disease response. The last thing when it comes to gut health is obviously pathogens. Some of us have bad bacterium inside of our gut. Some of us have yeast overgrowth. Some of us have fungal overgrowth inside of our body. Some of us have just not oftentimes been allowed to fight off bacterium and viruses like our body was supposed to. So we don't have a great antibody-mediated immune system. Maybe we need to get some more exposure to some bad things in our life, like going out and playing in the dirt and developing our immune system, again, because we don't have the right type of gut flora inside of our body to fight these things off. We do a lot of hormone testing in our office or gut testing in our office to figure this out. So if you're having problems with this, if you're a patient in our office, talk to us. If you're listening to this online, find us. BeAlignedHealth.com. We'll give you some resources. We're really good at finding and fixing the cause of these problems so we can get you healthy from the inside out. All right, so let's talk about nutrition for a healthy immune system. That is number 4. So what do we want to get out of our body? What do we want to get out of our diets? Well, some of the biggest things, and these are probably things you know, are sugars, are processed foods, are refined carbohydrates, are artificial sweeteners. And here's why. Our body can burn one of two things for fuel. It can burn sugar or it can burn fat. And for most of us, we've become a culture of sugar burners. There's sugar in everything now. Even if you look in pasta sauce, there's added sugars to it. When we're stressed, our body starts to crave sugar. And we know that most cancer cells actually feed on sugar as their primary fuel source. Sugar can raise cortisol. Sugar can lower our immune system. Sugar can break down our pancreas and cause our body to develop something called insulin resistance. In fact, chronic disease, so those are things like heart disease, cancer, and diabetes, all of those have roles in inflammation, and sugar, eating excessive amounts of it, is one of the biggest underlying causes of that. What we want to help switch you guys to is something to get you off of sugar, but in order to do that, you've got to realize that sugar or excessive amounts of carbohydrates are really not great for you. Now, there are some exceptions to that. If you're an extremely competitive athlete, then we want to have you eating some carbohydrates. If you have some types of liver problems, maybe your body's not as healthy at processing or breaking down fat as a fuel source. So there are some exceptions to the rule, but for most of us, we're consuming way more sugar than we should on a daily basis. Okay, the next thing would be processed foods. We know that people who eat processed foods have higher health hazards, have more inflammation inside of their body. So again, if you're eating something that is the nutritional equivalent of a Lunchable, which based on the average American's diet is 69% of the average American's diet is ultra highly processed foods, all the minerals, all the enzymes have gotten stripped out of those food sources. And so what you're really getting is a damaged product that's not going to bring life and health into the body. Okay, so opt away from processed foods whenever humanly possible. Refined carbohydrates are also terrible as well. Not only are they bad for our body from a glucose standpoint, but these types of refined carbohydrates can in fact make us even crave more sugar and again, directly lower our body's immune system. The last thing would be artificial sweeteners. A lot of times when we start to say that I'm going to eat healthier or I'm going to eat cleaner, we reach for those 0 or extremely low calorie options. My rule with food is do not count quantity of food. So don't count like just the calories in food. Count the quality of food. What are the quality of the nutrients that I'm getting? I'm not so concerned with the macronutrients when you're starting out to eat healthier, but what I don't want to do is eat a food that's a low quality. Artificial sweeteners, things like sucralose, things like aspartame have been shown directly to damage the gut microbiome, so they can lead to malabsorption. There's research studies showing that it can actually kill off the bacterium inside of your gut. And often people who consume lots of artificial sweeteners, they actually gain more weight than other people. So now that we understand what to get out, let's talk about what to get in. And so if you're replacing bad foods with good foods and you're satiated, this is an easy way to make long-term dietary changes. So the first thing that I want to encourage you guys to get more of in your diet if you want to get a healthier immune system is eating more healthy fat. Omega-3 fats are really important inside of the body. They make up the outer 2 layers of each one of the cells inside of your body. And so oftentimes we think that fat has been vilified as an enemy, when in reality, not eating enough fat leads to problems in your body. You can't create healthy cell membranes. Fat is actually used to make cholesterol. It's used to make testosterone. It's used to make estrogen, all of your hormones. In fact, your brain is composed mostly of fat. So if you're not getting fat into your diet, my question is, what are you making out of your body? What kind of cells are you making if you're not eating healthy fat? You're making damaged cells. And if you think about it, a cell that's damaged, that has an unhealthy cell membrane, doesn't have a good immune response. Those are the cells that die off faster. Those are the cells that become cancerous earlier. So again, if you're getting out sugar and you've got to burn something for fuel, you want to look for fat to be your source. So these are things like grass-fed, grass-finished dairy products if you're going to eat dairy at all. Some people with gut issues need to cut out dairy completely, because dairy for a lot of people can be inflammatory in the same way that gluten is. You want to use things like your nuts and seeds. You want to use cashews, almonds, pecans. You want to look into using hemp seeds, flax seeds, and chia seeds, which have amazingly high amounts of omega-3 fats. You want to eat wild-caught, grass-fed, or pasture-raised animal products. So grass-fed beef, wild-caught fish, pastured chickens. Those are animals that are going to have higher omega-3 fatty acid sources. So the question is not, should I or should I not eat meat? The question is, if you're going to, is it the right source? Conventionally raised cows and produce have been shown to have more pesticides, and in the meat that we eat, the fatty acid ratios are completely imbalanced. So cows that are fed grains and fed cereal and eating hay all day, they're going to have a higher inflammation profile. They're going to have more omega-6s, they're going to have less omega-3s, meaning their fats are inflammatory. They're not things your body's going to use readily for fuel. So don't eat the foods that make you sick, okay? High omega-3 fats, definitely a way to go. Next thing is getting high amounts of antioxidants into your body. Whenever we do lab and blood testing on people, we commonly find other than gut health, antioxidant issues are the second biggest problem that we see. We're not getting enough vitamin A, vitamin C, vitamin E. We're not getting enough phytonutrients that, again, help our body prevent itself from having oxidative stress. Just a quick note on what oxidative stress is, why you want antioxidants. Oxidative stress is the process by which our body ages. Basically, oxygen, what are called free radicals, every time we breathe, enter our body. And those free radicals, or those negatively charged particles, they rip protons off of our DNA strands. Over time, our DNA becomes so damaged it can't replace itself anymore. That's how we age. So the reason why you'd want to use lots of antioxidants is because if you're deficient in antioxidants, you are literally aging faster than your body should. So one of the best ways to get antioxidants is through eating berries. This is blueberries, blackberries, raspberries, strawberries. Low glycemic fruits like grapefruit have massive amounts of antioxidants in them. Easy way to do it, and when you do that, you're getting some sweet, but a lot of these berries have very low glycemic indexes in them, meaning they're not going to spike your blood sugar. They're not going to cause a massive insulin response. In fact, when we show some people how to eat with our advanced diet, berries, low glycemic berries and grapefruits and maybe some types of apples are all that they can have. That's a healing diet. We want to see you get more antioxidants into your body. Organic citrus, another big thing to use as well. Conventionally made citrus products now, like oranges, for example, they contain vastly lower amounts of vitamin C. So a lot of times I have people tell me, oh, I felt like I was getting sick and I went home and I bought some oranges, or I went to the store and I bought some oranges. Well, you've got to get the right ones. Organic fruits are going to be much better when it comes to nutrient density. So if you're feeling like you're coming down with some stuff or you want to raise your vitamin C overall, make sure you're getting organic citrus. Next thing would be consuming a lot of compounds like garlic, like oregano, like thyme, these herbs. Garlic contains allicin, which is a really potent compound that really helps to increase your body's immune system overall, helps kill viruses and bad bacteria. Overall, we're going to talk a little bit more about 2 different types of nutritional diets, but these are the things you want to work on increasing. Next thing we'll talk about, lifestyle changes. The first thing is you want to consider, if you want to get healthier this season, something called intermittent fasting. I think we've all heard of this before. Intermittent fasting is just going a period of time without eating on a daily basis. So literally fasting starts at 12 hours. You can go 12 hours without eating. Pretty simple to do. You eat at 7 p.m. and then you don't eat again until 7 a.m. Understanding the physiology behind this is that our body can only do certain chemical processes and certain hormonal processes when we're not digesting food. Breaking down food in our body is a very energy expensive action. And so if we're not breaking down food all the time, we can do other important things like autophagy, which is where our body goes through and kills bad cells before they become cancerous. So intermittent fasting is a great way to, again, allow your body to calm down. When you're fasted, your immune system increases. You get something increased in your body called brain-derived neurotrophic factor, which is how your body actually creates new synaptic neural connections. So it actually helps with brain and cognitive function. In men, we get a big spike in testosterone when we're intermittently fasting. The idea being if we're hungry, we're probably gonna hunt better. So intermittent fasting, extremely important to do overall. My recommendation is to start at 12 hours a day as a bare minimum, and then work your way up to 16 to 20 hours. Also, when you intermittently fast, it really helps your body's blood sugar. So if you're someone who's pre-diabetic, going periods of time without eating, especially if you're consuming fats as your primary fuel source, it's gonna give you a much more stabilized insulin level so that you're not falling into the realm of getting pre-diabetes, diabetes, or if you have it, expanding it. In fact, with a lot of people, going on a more advanced style diet helps people with diabetes or who are pre-diabetic get their blood sugar levels back to normal. And again, your body's response to insulin has a huge effect on how well your immune system works. So if you are pre-diabetic, which is 1 in 3 Americans, if you're diabetic, which is 1 in 5 Americans, that can cause a big issue. So intermittent fasting is a great lifestyle add-on that's gonna help your body a lot. There's also research now showing that eating a ketogenic diet or a advanced diet can help people who have cancer actually be something that kills cancer. There was a study that came out of aging in 2018 that showed 11 out of 13 types of cancer respond very well to a ketogenic or advanced style diet where you're eating lots of fat for fuel and much less carbohydrates overall. In our office, we talk about core versus advanced diets. And really, everyone should be at a minimum on a core diet. There's 3 simple rules for it. A core diet means that you're eating healthier forms of carbohydrates. You're getting rid of all the processed carbohydrates or the excessive amounts of carbohydrates, or just the things that have added sugar. So you're just switching for better versions of carbohydrates in general that you can still have them. You're eating lots of healthy fats and you're eating clean amounts of protein and really being picky about your protein sources like we talked about before. That's all a core diet is you're just eating natural, healthy foods in good proportions. You're not excessively high on fat, you're getting moderate amounts of carbohydrates. Most people can do that diet and manage it for a long time. So what that looks like is 35 to 50% of your diet is fat, around 25% of your diet is carbohydrates, and around 25% of your diet is protein. Pretty easy for most people to follow. For some of us who have immune system problems or really want to go on a healing protocol, who are dealing with autoimmune disease or cancer or heart disease or diabetes or things like that, we recommend using a more advanced version of that same diet. All we're doing is taking those principles and tweaking around your macronutrients, which are your fat, your carbohydrates, your proteins. We're tweaking those ratios around so that we elicit a ketogenic response, or a response where your body basically runs out of stored sugar, which your body contains about 3,000 to 4,000 calories of stored sugar in your body. So that ketogenic response basically takes all the stored sugar out of your body, and then guess what? You start burning for fuel, fat, which is a really good thing. For most of us, we store tens, if not hundreds of thousands of calories of fat in our body. In fact, for most people, burning fat is our preferred fuel source, but your body more readily burns sugar. So unfortunately, we become, for a lot of us, sugar burners, where we're just eating and burning sugar all day long. We never give our body a chance to break down and digest fat. So if you're having problems or issues like that, using an advanced diet or an advanced ketogenic diet, where you're raising your fat, you're lowering your carbohydrates to 50 grams roughly or less a day, and you're moderating your protein intake, not intaking too much protein, massive healing effects. We see people lose tons of weight, burn body fat effectively, recover from cognitive problems, overcome autoimmune disorders. It helps reduce cancer risk. It helps lower blood pressure for people. It really helps overall to get you healthier. If you guys have more questions on the core of the advanced diet, we'd love to sit down with you. Call our office. We'll help you figure this stuff out. All right, next is low intensity interval training versus high intensity interval training. This is all about exercise, and a lot of people will talk, well, doc, what should I do for exercise? Should I be walking? Should I be doing weightlifting? Should I be doing HIIT training, which is the where I'm sweating a lot? I'm doing fast burst training. The reality is that your body needs a good combination of all of these different types of exercise for you to be healthy. Okay, so low intensity interval training, that's something that we do every day. That's walking, that's moving, that's being active. I know that sounds silly, but the average person sits 12 hours a day in the US. We need about 12 hours of movement per day. So we're the exact opposite. We're sitting 12 hours a day on average. We're moving 4 or less. We should be moving 12, and then we can get away with sitting 3 or 4 hours a day. Most of us are backwards on that. So low intensity training is not what you think it is. It's not going to the gym. It's just moving. It's walking, it's getting active, it's stretching, it's practicing some mindfulness and breath work at home. Our body needs that. Get this. If you walk 30 minutes after a meal, so just get up, take your spouse, take your kids, take your dogs, whatever it is, take yourself out and go for a walk afterwards. It drastically reduces the insulin spike that you have after a meal. So if you want to regulate your blood sugar, if you want to lower your insulin levels, simply walking for 30 minutes after a meal, 20 to 30 minutes, has a massive effect on your overall health. I didn't have to buy a gym membership. I didn't have to go sweat to get those metabolic benefits. Our body is made to move, and low intensity training is an important component of that. Now, on top of that, you do want to do things that stress your body in a good sense. I want good muscle tone for a lifetime because good muscles mean I have healthy testosterone, which fights aging. So high intensity interval training, weight training, absolutely mandatory things for long-term health. Doing an 8 to 12 minute high intensity interval training workout, when you spend 20 seconds working hard and then 20 seconds resting, doing that repetitively back and forth, you can get a great workout in 8 to 12 minutes that has a massive hormonal response. So get this, they did a research study where they took people and they gave them a workout. And some people got 30 minutes to do the workout, and other people got 10 minutes to do the same workout. So these people did the same amount of work, but one group had to do it in a third of the time. Well, they looked at them 12 weeks later and they said, wow, the people who worked slower, so had just more time to do their workout, during the time of the study, they didn't lose any body fat at all. Well, the people who worked out with the same amount in a shorter amount of time, they burnt an average of 3.1 pounds more body fat than the other group. So again, sometimes it's not that you're going to the gym or putting in the effort, you need to do it in the right way. So that's why I love high intensity interval training. You can look it up as Tabata intervals as well. Great format to do. You can do this at home, you can do it at the gym. Incorporating strength training with that's really important as well because again, you have to stress your body with weights, with resistance to tell it to actually build muscle tone and burn body fat. And we know that people who do these things well live longer. The last lifestyle change that we'll talk about is having an aligned spine or being well adjusted. The number 1 and number 4 cause of disability in the US are back issues. Back issues or lower back issues are the number 1 cause that we become disabled. The number 4 cause is having neck issues. What does that mean? Well, becoming disabled is meaning you can't do the things that you love to do. Spend time with your family, provide for your family, work, play, run around, take vacations in comfort, doing all of those things. And so what a lot of times we don't talk about is the importance of spinal health in longevity or in immune system function. Well, we know that people who have a well-aligned spine, they've done a 5-year research study on this, people who are well-adjusted, who have healthily aligned spines, have immune systems that are about 200% of greater competence than people who don't get adjusted. So just in alone in taking care of your spine, keeping your body healthy, people who have better immune system function. There's other research studies. There was a 7-year research study that showed that people who take care of their spine, they spend 69% less than the national average on overall healthcare costs. And another article out of Spine Journal in 2005 showed that people who get adjusted and take care of their spine, they lower their surgery risk by 28 times their spinal surgery risk. Those are some of the biggest causes of disability right there that we take care of by keeping our spine healthy. With the way that our posture is, with the way that 21st century technology is going, I don't see back issues going away. So we have to work on taking care of our spine as early as possible and maintaining it in good alignment for the rest of our life. So you can do lifestyle activities to get that better, like using your cell phone less, like standing more at work. If you've never had your spine checked or maintained, it's very important to do by a good corrective care chiropractor. Someone who looks at the alignment of your spine, your posture, and doesn't just work on you to make you feel better, but works on your spine to truly align it better. Most research experts agree that our spine should last 100 to 120 years. If our spine's in a bad alignment, it can wear out decades ahead of that. In our office, we take care now of people in their 20s and teens who have arthritis in their spine because their posture is so bad. So again, getting adjusted, taking care of your spine, extremely important to do. I've got two more things to talk about on this that I just think are fascinating. There was a research study that came out in 2019. For years, we've maybe heard that sometimes chiropractors can cause blood supply problems. There were once reports that, oh, chiropractors can cause strokes or cause problems like that. Well, there was a study that was done in 2016 that showed if you had poor posture, so if your neck were in a bad position, I'll show it to you guys. If your neck is like this, right? There was research showing if your neck was in a bad alignment, that you could actually occlude blood flow to your brain. So this could cause more cognitive issues, more cognitive problems, just from having poor posture. Well, 3 years later, a group of researchers got together and said, well, if that's true, if I have poor posture, it can cause blood supply problems in my head. What would it mean if I have good posture? So they took a group of people and they actually worked on correcting the alignment of their spine and posture. And what they found was not that they had higher risk of stroke or problems like that. They found that they actually had increased blood supply to their brainstem and to the base part of their brain. So they got more blood supply to their brain, which means better healing, better cognitive function, all of those things, just from getting adjusted. Again, things you would never think about because most people associate getting adjusted with having pain. And the reality is you don't have to have pain to take care of your spine. In fact, a lot of people who come to our office for the first time or who are maintaining their spine for a lifetime, they don't have pain. What they have is a need to be healthy. And again, getting adjusted, taking care of your spine is one of the most important things you can do to improve your quality of life, to move well, to be able to work out and exercise and have the energy to do those things that you want to do. Taking care of your spine is the best way to do that. So get adjusted and take care of your nervous system while you're at it, okay? The last thing we'll talk about here are the important supplements to take or to have in your arsenal if you want to keep a healthy immune system overall. Those supplements, in no particular order of importance, are things like vitamin C, vitamin D, zinc, which I'm sure that you guys have heard of, that cocktail, CD zinc, really important. Another one called N-acetylcysteine, I'll describe that to you as well. So obviously vitamin C works on boosting our body's overall immune system. It helps activate our immune system. Vitamin D deficiency is one of the most common causes of immune system disorders that we know of. In fact, if you're deficient in vitamin D, it raises your risk for 12 different types of cancer. Obviously, you can get vitamin D by going outside and exposing yourself to direct sunlight. As we move into winter and fall months, that doesn't work anymore. Your body doesn't synthesize vitamin D. It's very important for creating hormones in our body. So a lot of times when people have vitamin D deficiency, they develop not only immune system issues, but mood issues. You've heard of seasonal affective disorder before, I'm sure. That's where we just feel glum and blue during the cold season. So if you're having those issues or problems going on, using vitamin C or vitamin D to improve immunity is really going to help with that. Zinc is another one that's commonly talked about. Zinc works in a really cool way to help your body's immune system. It actually stops viruses from being able to replicate inside of your DNA. So it can be a very potent antiviral. Now, a lot of us get from daily food sources. So we can get it from red meats, from organ meats, from shellfish. We can get zinc on a daily basis. However, if you are really fighting something off or you've been exposed a lot in the past few weeks, you may want to look at adding zinc into your daily protocol to work on getting to a sufficient status with it, okay? The last supplement that I talked about was NAC, or N-acetylcysteine. So what is NAC? You might have heard about it before. During COVID, there were massive amounts of talks on N-acetylcysteine, its importance in the body. What we see is that it, along with two other amino acids, is a precursor. When you combine those together, they become something called glutathione. Glutathione is your body's most potent antioxidant. So the first reason why I think taking N-acetylcysteine is so important is because it's usually your body's rate limiting step in making glutathione. Meaning if you're deficient in cysteine, you can't produce your body's most important antioxidant. And a lot of us are really deficient in that. So the first thing is it actually helps your body arm itself. It really works to help your liver detoxify you. And the other big thing is N-acetylcysteine acts as a mucolytic. So what a mucolytic is it's something that actually helps to break down mucus production inside of your body. You know, a lot of times when we have sniffles or congestion, that stuff gets stuck up in there. And the fact that we can't break that down means that that infection, that sickness, that illness, that sinus problem, whatever it is, spends longer there. And again, if we have tons of fluids in our nostrils or in our sinus cavities, and those get stuck in there, those can cause our infections to ebb on and on and on. So I love having N-acetylcysteine in my arsenal. It really helps to break down mucus, clear out our sinuses. It's been shown to actually help with viscosity of our arteriovascular system. So it's been shown to kind of thin out our blood a little bit. And again, it really helps make this potent antioxidant called glutathione, which can really help keep our body healthy. People ask me commonly, how do I know what nutrients or what supplements I need to take? There's no way of me just looking at someone, or any doctor just looking at someone and says, oh, you need to take this. In reality, it's all a guess unless you test. And so the resource that we've been using a lot for our patients and for our online patients and people we take care of is an organic acids test. If you want to look at toxicity, deficiency, nutrient deficiency inside of your body, doing an organic acids test is actually going to tell you what you need. It's going to look at compounds that come out of your urine, blood, and or saliva. We test all three of those to find out where you may be deficient. Maybe your gut isn't unhealthy. Maybe it's just that you have nutrient deficiencies. Maybe you have toxic heavy metals in your body. We need to work on those. Testing is the best way that we can figure out where you are and what you need. Because again, without data, we're really just guessing. I think that these are some of the best nutrients that you can get in your body and have in your arsenal during this cold and flu season to work on building your immunity, but maybe you need something specific. So if you've never had organic acid testing done or want to get more information on it, go to our website, schedule a consultation and examination with us, or if you're a current active patient in our office, just talk to us. We'd love to give you more advice on it and help you through these things. Hope this event has been helpful for you guys. If you enjoyed this, make sure you like it. Make sure you subscribe to our channel as well. We're releasing new videos every week now, and we want to make sure that you're on the cutting edge of keeping yourself, your family, and this community at its healthiest. Hope you guys enjoyed it. Have a great day. Take care.